Old versus new plastic surgery techniques. Over the years, human beings have been actively involved in self-improvement. While the development of plastic surgery is popularly believed to have taken place over 20 years ago, it has been proved that origins of plastic surgery are quite old. Physicians in the ancient history used skin grafts for reconstructive work. Ancient plastic surgery. Reconstructive surgeries were being carried out in India as early as 800 BC. A Hindu surgeon, Sushruta, reconstructed a nose using a piece of cheek. He also published the Sushruta Samhita, which is a collection of medical texts on plastic surgery and the first of its kind in ancient history. The medical works of Sushruta was translated into Arabic in 750 BC, and made their way into Europe via intermediaries. The progress of plastic surgery was slow over the following 1,000 years. The India techniques introduced in the West was gradually improved and adapted for new applications. Major development in medicine took place during the Greco-Roman period. During this period, a Roman medical writer, Aulus Cornelius, wrote various texts, which laid out surgical methods for ears, lips, and nose reconstruction. A detailed medical encyclopedia entitled Synagogue Medici was compiled during the early Byzantine period. This book contained various reconstructive techniques dedicated to repair facial defects. Middle Ages and the Renaissance. During the Renaissance, major scientific developments were made which resulted in development of safer surgical techniques. In the 15th century, an Islamic text was written on maxillofacial surgery, eyelid surgery, and a protocol for the treatment of gynecomastia, which is considered as the foundation of modern-day surgical breast reduction. Plastic surgery during the war. The most significant improvements in the field of plastic surgery occurred during the First World War, when reconstructive surgery was a necessity for the casualties of war. Military physicians treated many facial and head injuries caused by modern weapons. Skin grafting techniques such as the tubed pedicle graft were developed during this time to treat facial burns. It was during this time that physicians came to understand the influence an individual's appearance could have on the level of success experienced in his or her life. This realization led surgeons to perform more complex procedures. The 1940s and 50s. In 1946, the first issue of the Journal of Plastic and Reconstructive Surgery was published and served as a forum for dissemination of knowledge among plastic surgeons and their colleagues. During the Korean War, more complex reconstructive procedures such as wiring techniques to correct facial fractures and use of rotation flaps to correct deformities were performed. Exciting new facelift plastic surgery techniques. SMAS adjustment. Last century, the typical strategy for removing forehead wrinkles was to basically just lift the skin, pull it tight, and reattach it. This removed wrinkles but often created a somewhat unnatural look. That isn't a problem with modern superficial musculo-aponeurotic system, SMAS adjustment. The SMAS is a thin layer of tissue connecting the skin to the underlying muscle layer. By adjusting SMAS along with the skin, the results are much more natural looking and allow for easier facial movement as well. Facial fat rejuvenation. Another unfortunate side effect of the old lift, stretch, and reattach method of facelift plastic surgery is that it did nothing to reshape the face underneath the skin. Today's plastic surgeons take a much more comprehensive approach. Facelifts are now often combined with liposuction to remove the fat buildup which accompanies aging. In some cases, plastic surgeons could even resculpt the entire face by taking small amounts of fat from other parts of the body and using it somewhat like clay to create new facial structures, such as in people who want more prominent cheeks or jaws. Combinatory techniques. Generally speaking, in the past, facelifts would be considered one single procedure. Plastic surgeons would be hesitant to do too much at once. Today, however, there are a multitude of techniques which can all be applied at once. A facelift might be combined with Botox injections, for example, to erase wrinkles that traditional facelifts can't handle. Dermal fillers, ultrasound, and laser resurfacing can be deployed as well, to create even more dramatic effects. In short, the possibilities in modern facelifts are nearly endless.